this is the model of the anterior compartment of the thigh. Okay, so if you can appreciate here, I've tried to draw the T12 to L1, L2, L3, L4, L5 vertebrae. The psoas major is the first muscle I want you to appreciate. The psoas major takes its fibers from T12 to L4. It takes these fibers up and it goes and inserts into the lesser trochanter of the femur. So this is, here you can appreciate, is the lesser trochanter of the femur, right? So this femur is basically making your hip joint right here. Now this is your psoas major muscle. It comes off from the T12 to L4 fibers and goes and inserts into the lesser trochanter of the femur. Now the other muscle that joins the psoas major in its insertion to the lesser trochanter is the iliacus. The iliacus muscle comes off from this entire iliac fossa. Can you appreciate this? Entire iliac fossa is where the iliacus comes off from. The fossa of the iliac fossa, the ala of the sacrum, some sacrotuberous ligaments. So this iliacus and psoas major join and insert themselves into the lesser trochanter of the femur here, and together we call them the iliopsoas. Okay, one thing is that the femoral nerve, we will see later on, comes off from the lateral margin of the psoas major. This is very commonly asked in the exam. Then we have the next muscle, which is our sartorius. Let's look at the sartorius first. So this is the sartorius muscle. Okay, so the sartorius muscle, where does it originate from? Sartorius muscle originates from the anterior superior iliac spine. Okay, so can you appreciate this here, that the sartorius muscle is coming off from the anterior superior iliac spine here of the hip bone. So from the anterior superior iliac spine, the sartorius muscle comes, and where does it insert? Basically, the sartorius muscle inserts in this pes anserus. There's a pes anserus on the tibia. So this is the tibia, and there's a pes anserus, which is a goose-shaped area on the medial tibia, and three muscles take its insertion here: the gracilis, the semitendinosus, and the sartorius here. Okay, so if I take the sartorius out, I can just take the sartorius out and then explain the rest of the muscles. When we talk about the quadriceps femoris muscles, we have four muscles in the quadriceps femoris. We have the vastus medialis here. This is the vastus medialis. Then we have the vastus intermedius, and then superficial to the vastus intermedius we have the rectus femoris, and on the lateral side we have this vastus lateralis. Can you see this vastus lateralis here? This one. This is the vastus lateralis. Okay. So on the lateral side here we have the vastus lateralis. On the medial side here we have the vastus medialis. And then we have the vastus intermedius, superficial to which we have the rectus femoris. Okay, so that is something. Okay, now other than these four muscles, we need to see their origins, right? Okay, so the origin of the vastus medialis is basically the medial lip of the linea aspera, lower two-third of the linea aspera, and the medial supracondylar ridge of the femur. And the vastus lateralis origin is basically the lateral lip of the linea aspera, and lateral supracondylar ridge is the origin of the vastus lateralis. Then we have the vastus intermedius. The vastus intermedius takes its origin from the anterior two-third and lateral of the lateral shaft of the femur. Okay, and the rectus femoris is special. The rectus femoris, I have removed the psoas major and iliacus to show you the two origins of the rectus femoris. The rectus femoris is special because it takes its origin from the anterior inferior iliac spine and also the superior acetabulum groove at the back. So can you see this area? This area. This is also from where this superior or acetabular groove here. This is the second place the rectus femoris takes its origin from. This reflected head of the rectus femoris takes its origin from the superior acetabular groove, and the other direct head of the rectus femoris comes off from the anterior inferior iliac spine. Okay, so after those two heads of the rectus femoris have emerged, we have the vastus intermedius, we have the vastus lateralis here, the medialis here, and superficially we have the rectus femoris here, right? Let me remove this femoral nerve. Okay, so all four of these muscles of the quadriceps femoris insert into the patellar tendon by creating this quadriceps tendon. This is your patella, right? So all four of these muscles insert into this quadriceps femoris tendon into the patella, and they further create this patellar ligament which attaches itself to the tibial tuberosity. Okay, the one last muscle that we should appreciate is basically the the tensor fascia lata, which creates the iliotibial tract. The tensor fascia lata basically starts here from the anterior superior iliac spine. At the anterior superior iliac spine, it takes fibers from the gluteus maximus muscle and creates this tensor fascia lata, which in the lower part of the tensor fascia lata structure becomes a muscular part and then goes and inserts into the Gerdy's tubercle of the tibia. This is a very common OSPE question. After we have finished the tensor fascia lata, we are done with all of the muscles of the anterior compartment. We will now look at the femoral nerve. Now the femoral nerve comes off of the anterior. Let's look at the femoral nerve. The femoral nerve comes off from the posterior division of the anterior rami of L2, L3 and L4. So there are anterior rami of L2, L3 and L4, and both of them give you an anterior division and a posterior division. The three posterior divisions of the anterior rami of L2, L3 and L4 combine to form the femoral nerve. The femoral nerve runs in the border of the psoas major and then gets sandwiched between the iliacus and the psoas major muscle. Can you see it's sandwiched here? So here it gives a nerve to the iliacus muscle. And then can you see this inguinal ligament here? The inguinal ligament runs from the pubic tubercle to the anterior superior iliac spine here. This is the inguinal ligament. And the femoral nerve runs beneath it. The femoral nerve comes off from the midpoint of the inguinal nerve here. It runs basically beneath it. The femoral nerve comes off from the midpoint of the inguinal ligament. When it comes out of the midpoint of the inguinal ligament, it gives one nerve to the pectineus muscle here. After giving this nerve to the pectineus muscle, it basically divides into two major divisions. Okay, the first major division is basically the anterior division. This is the anterior division, we'll put it medially, and the other division is basically the posterior division, we'll put it laterally. The anterior division quietly gives you one branch to the sartorius. Here it gives you one branch to the sartorius, and then it quietly goes and becomes the anterior cutaneous nerve of the thigh, which we also call the immediate or intermediate nerve of the thigh. The other posterior division basically gives all the branches to the quadriceps femoris. So can you see that the rectus femoris and the rectus femoris is nerve is given by the posterior division, and then the vastus lateralis is given, and then the vastus intermedius is also given by this, and then the vastus lateralis, medialis, rectus femoris and lateralis all are supplied, all the quadriceps are supplied by the posterior division of this femoral nerve, okay, this posterior division. And then this posterior division continues as the saphenous nerve into the leg. So this saphenous nerve also becomes continuous, which was the posterior division of the femoral nerve, and the anterior division was creating the anterior cutaneous nerve of the thigh. So the only branch of the femoral nerve that goes as the cutaneous branch in the leg is basically the saphenous nerve, and this is a branch of the femoral nerve. Hope that's clear.